So if you've recently been told that you have knee arthritis, you might be feeling a little bit old. But I'm here to try and take the sting out of that and to show you some exercises that you can do to try and strengthen up your knees to try and get to the bottom of your pain. A lot of the time, a knee pain can be very distressing. It's very sharp and painful when you walk up and down stairs. Perhaps if you wake up in the mornings, it feels very stiff and sore to get going. But these are common complaints, and we can get around them using a couple of exercises or a couple of tips. So the first thing is to get moving. So first thing in the morning, it might feel a little bit stiff. A nice thing to do is to sit over the edge of the bed and just give your knee a little bit of a swing. That distraction in your knee and the mobility helps to improve the circulation and the nutrition to the joint. Much like a sponge, if you can imagine that a sponge will soak up a whole bunch of dirty water, and to get the dirty water out, you need to squeeze it so that you can allow it to expand to suck up clean water. This happens often with the joint cartilage, and so what we're trying to do is to try and get some movement and a pumping action to try and flush out the dirty old water and get fresh nutrition to your knee. So movement is actually good, and strengthening is even better. This has been shown to treat knee pain, and I'm going to show you a couple of exercises that you can do. So exercising when you're in pain may be a little bit daunting, and that's why we're going to start off slow. So what we're going to do is start off lying down or sitting down, and that way you're taking the weight off your knee and you don't have to overexert it if it is feeling a bit sore. If you do not have that much pain, then you can move on to the standing exercises that follow. But for now, just to get your muscles activated and to get stronger again, you can do it sitting down. So what you'll need is a little ball. You can either use something like this, or a rolled up towel, or a folded scatter cushion just to pop under your knee, and we're going to get started with these. So what you're going to do is pop this underneath your knee. So sitting on a firm surface, either on the floor or on a mat, is easier. Your bed might be a little bit soft. So you're going to pop this underneath your knee, and what you're going to do then is to try and squeeze your thigh muscle. You're going to then lift your heel up off the bed, and you're going to hold that for maybe 10 seconds and then lower down. So this is to try and activate the squeeze and activate your quads. This will help to control your kneecap. And a lot of strength from this muscle will help to stabilize your knee. So start off maybe as a baseline of 3 sets of 10. If it doesn't feel strong enough or there's pain, start off with 3 sets of 6 to 8 and build up from there. If that's getting too easy and you can't feel that there's anything happening, you're going to take the ball out, and then you're going to do a pure straight leg raise. So in this position, you're going to squeeze your thigh as tight as you can, try and lift your heel up off the bed, and then do a leg lift. If it's too hard for you to do sitting, you can do it lying down and do it in that position. You can then turn your foot out and maybe raise your heel towards the ceiling. And if you're feeling adventurous, you can add some moves, so you can lift out and in, maybe some circles. Keep your toes up as well. And again, start there with a baseline again of 3 sets of 10. A little bit more if you are feeling strong, and a little bit less if you're feeling a bit sore. Exercises we do are called bridges. They help to strengthen up the glutes. These we know are for the muscles of the pelvis, and they help to keep our pelvis level when we walk. So what we're going to do is grab a little ball, you fold up a towel, or you fold it up pillow. You're going to pop it between your knees. You're going to lie on your back. What you're going to do first is to squeeze your knees into the ball or to the rolled up towel. This will help to activate your inner thighs and the inner section of your quads. You're then going to keep squeezing that ball. You're going to tilt your hips towards you, squeeze your bum, and lift up. Hold there for a few seconds, keeping the tilt, back to neutral, and release. You'll feel this working on the inner thighs and into your hips. Again, you can go with the 3 sets of 10. If you're feeling strong, go a little bit more. If you're feeling not so strong, a little bit less. So the next exercise, we're going to use a bit of a TheraBand around your knees. If you don't have a TheraBand, you can wrap some stockings around your legs and tie them, Otherwise, you can use the TheraBand loops or the band that you can buy from a sports store. So what you're going to do is you're going to squeeze your legs out against the band, and then the same as we did before, tilt your hips towards you, squeeze your glutes and lift, and then lower down and return to neutral. So again, you're going with our 3 sets of 10 if you can. If not, a little bit more or a little bit less depending on your ability. What you can do to make it harder is you're going to pull towards you, lift up, and in this position you can add a pulse and then return to neutral. Good, give those a go and see how you get on. If you are a little bit stronger and you're ready to take your exercises to another level, you're now going to add the weight bearing status to your knee. So what you're going to do now is maybe a supported wall squat. So if you stand against the wall, you're going to keep your TheraBand around your knees, walk yourself forward a little bit, and now you're going to lower yourself down and push your knees out against the TheraBand. You can either do pulses out sideways here, otherwise you can just hold it, or otherwise you can slide up and down. These are all really good exercises for your glutes and your quads. Then to get your inner thighs and the inside version of your quads working, you're going to grab your folded towel or your little ball, and then again you're going to go between your knees. You're going to squeeze the ball between your knees and either do pulses into the ball. You can sink down a little bit lower and hold it, or in this position you can do the squeezes into the ball. Only go as far down as you are comfortable with, and as long as it is not hurting the front of your knee. Another nice exercise to do is a step up. So find a step in the house where you've got a handrail you can hang on to. What you're going to do is try and lift yourself up onto the step and then lower yourself back down slowly without falling down. Slowly up, slowly down, slowly up, slowly down. And repeat that on both legs. So I hope some of these exercises will be beneficial to you. Just take it easy, don't work too hard, but progressively load through these exercises until you're feeling better. If you feel like you need a stick, remember to walk with a stick in the opposite hand of the painful knee. If you have overdone it with the exercises, maybe use an ice pack or a heat pack, or have a nice warm bath depending on what works best for you. You can also remember to wear comfortable shoes, nice supportive trainers or tackies that you can really get some shock absorption, because remember the cartilage is a little bit sensitive, so adding some shock absorption to your shoes will also help. I hope some of these tips will help you. Let me know how you get on and leave a comment below, or otherwise get in touch with the practice if you need any further advice.